We started the Plantation Park Heights with the collective, which is the community, the children from elementary schools, artists, politicians, leaders. We decided we're going to grow food to feed us. We wanted to create not a non-profit to be continuously dependent on grants. We wanted to create a community-owned business that will share the spoils and create, in the end, generational wealth, which has been denied in the past.
The farm, like Farmer Chippy likes to call it, is a vibe. You know, you have to come to the farm and experience the farm yourself to feel what they're doing and how they're helping out. You know, you just have to come and experience what the farm does for this community.
I am originally from Baltimore, and the young people in the Asian community motivate me to serve and do this work every day, as well as educating myself on health and being able to eat better.
The Agri-Hood Baltimore food box distribution is key to bringing the community together. It is what brings senior adults together with students, talking about the history of Park Heights, inviting them to eat the herbs and the food, focusing on vegetable and nutrients. So this has become a vetting ground for cleaner, greener foods, and I love it.
Seeing a child's eyes light up when they smell sage and say, "This smells like sausage," it gives me the opportunity to tell them, you know, really it's not the meat that we fall in love with, it's the herbs and the vegetables. Because if you boil a piece of plain chicken, you ain't gonna like it. But if you add garlic, so explaining these things to them and correlating it to their health so that they can connect the dots, not only with what they see on the outside, but what's going on the inside. Because health starts here and here first.
My interest for this project was really to see how we could potentially reduce health disparities in a community like Park Heights.
Park Heights is like a food desert in certain communities, so that means like you don't have access to fresh food easily. You have to drive far, and then oftentimes it's very expensive. So this was a big help to people. People are more willing to cook instead of going out to eat.
Jenny was a researcher at Hopkins, and we talked, and we tried to find ways where we can get the food to people.
We were really lucky to get funded by the Bloomberg American Health Initiative.
We realized that we could really do what we want to, which was understand the health and wellness of the people while eating this box during COVID. How will we measure that? What do we do?
We would help distribute the food boxes to the cars, and then while we did that, we would ask people if they were interested in like talking about their experience with the boxes.
It didn't feel like research, it felt like community. So I think that it made them more receptive to giving me their data because I already knew them.
But I think that's really the ideal situation for a community-engaged research project.
What the participants said that was the strength was really the proximity of the food and the cost that it was free of charge.
There were so many stories in the interviews that really stuck with me in terms of people being like, I had these free produce boxes and my blood sugar levels improved. Figuring out how medicine and how physicians can really start thinking about these things, I think is an area of need.
With that said, we came up with a formula, and Jenny, of course, submitted to the IRB project under Bloomberg. It was approved, and we have completed the study. We're just waiting to be published.
Just knowing the history that Johns Hopkins has had with Black communities in Baltimore, I feel like the collaboration with Hopkins in the community is very, very important.
I feel like I did have a lot of support to really make genuine connections here and represent Hopkins and the resources that we could provide.
People now seeing them engage with communities like this, pulling up at our free box giveaway for years, it allows you to be able to see that people can change.
It further solidified my passion for working with marginalized groups. I know that Black people have better health outcomes when they're cared for by people who look like them.
And that is what Agri-Hood Baltimore is all about, and that is what this collaboration is all about. Bringing people together to understand nutrients and appreciate the place where they live. Share stories together so we don't have to keep repeating bad history. You do not know what this means to a retired biomedical engineer to receive the Henrietta Lacks Award.